This is the fifth video on fatty liver and we'll discuss diet. A healthy diet is an important part in the management of fatty liver. The following diet is a diet bad for fatty liver. This picture shows a diet that is rich in saturated fat, processed grains, and trans fat. Saturated fats increases the blood cholesterol levels, facilitating the deposition of fat in the liver. This includes beef, pork, bacon, lamb, hot dogs, sausages, processed meats, cheese, full cream milk, ice cream, butter, and mayonnaise. Processed grains and refined carbohydrates contain carbohydrates and when absorbed cause a rapid spike in blood glucose. This picture shows foods that are rich in processed grains and refined carbohydrates. The excess glucose is converted to fat in the liver. These foods are also calorie rich and promote weight gain. Often these are foods with a high glycemic index. The glycemic index is a number from 0 to 100 assigned to a food, with pure glucose arbitrarily given the value of 100. GI index reflects the relative rise in the blood glucose level 2 hours after consuming that food. The higher the number, the greater the rapid rise of blood sugar and consequent fatty liver. Foods with a high GI index include white rice, white bread, pasta, pizza, many breakfast cereals, and sweet desserts. These are foods that are generally not good for health, particularly in diabetes and fatty liver. Trans fat increases bad cholesterol and reduces good cholesterol. Trans fat is among the bad fats and it results in an increase in liver fat deposition. Most trans fat is formed through an industrial process that adds hydrogen to vegetable oil, which causes the oil to become solid at room temperature. This is also called partially hydrogenated oil and is less likely to spoil, so makes foods with it have a longer shelf life. An example in this picture is French fries. This picture also shows foods that contain bad fats and foods that contain good fats. Trans fat is found in margarine, packaged snacks, baked foods, breakfast cereals, and fried food. Another type of food that is bad for the fatty liver are foods that contain high fructose corn syrup. High fructose corn syrup contains a lot of a sugar called fructose. Fructose is even worse than glucose in promoting liver fat deposition. Limiting the consumption of drinks and food that contain fructose is a good idea. A lot of sweeteners contain fructose. Many such sweeteners are made from high fructose corn syrup. High fructose corn syrup is a sugar made from corn syrup. It has replaced natural sugar in a lot of drinks and foods, primarily because it is cheaper. It is found in a lot of processed foods as is shown in this picture. In summary, it is recommended that patients with fatty liver try to avoid or at least try to reduce saturated fats, trans fats, processed grains, refined carbohydrates, hydrogenated oils, and foods containing high fructose corn syrup. So what kind of food is recommended in fatty liver? A diet rich in fruits and vegetables, complex carbohydrates with a low GI index like brown rice, buckwheat, barley, quinoa, lean meat like skinless turkey and chicken, and increase the fiber in the diet. This will slow down the absorption of glucose from the intestine and help to reduce spikes in blood sugar levels found in oats, oat bran, dried beans, citrus fruits, apples.
Glycemic index or GI is a number from 0 to 100 assigned to a food with pure glucose given a number of 100, which represents how fast the blood glucose rises 2 hours after consuming the food. Foods low in GI appear to be beneficial for health, especially in those with fatty liver, insulin resistance, and type 2 diabetes mellitus. Foods with low GI, 55 or below, are preferable. GI of foods depends on the type of starch in the food. Starch has two types of molecules, amylose and amylopectin. The higher the amylose content, the lower the GI. Long grain rice has a high amylose content compared to short grain rice. Hence, long grain rice has a lower GI. The amount of fiber. The lower the fiber content of food, the higher the GI index. Ripeness of fruit. The more ripe the fruit, the higher the GI. Cooking. Generally, the longer the food is cooked, the higher the GI. Refining. The more the food is refined by grinding and rolling, the higher the GI. This table shows the glycemic index of different kinds of vegetables, fruits, and other miscellaneous foods. The foods in red color have a high GI index, while those in green have a low GI index of 55 and below, and these are foods that are preferred. So patients who have insulin resistance, fatty liver, and type 2 diabetes mellitus should preferably take foods that have a low GI of 55 or below, which is given in green in this table. This is another table that shows the glycemic index of different kinds of rice, bread, cereals, and some types of Italian pasta, as well as different types of Indian food. We should also remember that the GI of cooked food will depend on the ingredients that have gone into the recipe. Also, the GI index is often an estimate and may vary from region to region, also whether it's raw or cooked and how it is prepared. Monounsaturated oils in moderation, found in canola oil, olive oil, avocado, nuts, peanut oil, and butter. Foods rich in omega-3 fatty acid helps to improve fatty liver, found in salmon, tuna, sardines, walnuts, chia seeds, flaxseed oil. And not to forget coffee. A minimum of 2 cups of coffee might be good for the liver. Some studies have shown that coffee can reduce liver damage and cut down the risk of liver cirrhosis and even liver cancer.